Hello all, in this video we will see about previous year important questions for dental students from general medicine subject. This will be really useful for all the exam goers. If you are short of time, please make sure that you prepare these questions so that you will really score a good mark in your exams, both for Viva and for theory exam. So moving on with the first chapter, cardiovascular system. Note the topics here. Cardiac failure has been often asked. It is an important essay. So, whenever they ask an essay, you should always write definition, etiology, pathogenesis, classification if it is available, and clinical features, followed by investigations and treatment. So, in this question, they have asked only these five topics, but make sure that you also write clinical features, management, which has not been asked. Clinical features they have not mentioned here. Pathogenesis they have not. Oh, pathogenesis they have mentioned, but clinical features is missing. So even if they don't ask for any essay question, make sure that you write an answer under these subheadings. So in cardiac failure, they have also asked about congestive cardiac failure, acute left ventricular failure, and moving on to the next subheading, congenital heart disease. It is again an essay, so mention all the major congenital heart diseases. They have also asked about tetralogy of Fallot as an essay separately, atrial septal defect, ventricular septal defect, and the precautions before invasive dental procedure if patient reports with ventricular septal defect, patent ductus arteriosus. Another major topic, infective endocarditis. It is very significant in a dental setup. So precautions in dental setup is must if they ask a question on infective endocarditis. So what is the antibiotic prophylaxis? So you should mention about that. Myocardial infarction and the risk factors. Angina pectoris and acute myocardial infarction is an essay. Complications of myocardial infarction. How do you manage myocardial infarction is very important. Clubbing, a clinical feature in cardiac disease. Cardiopulmonary resuscitation, CPR, commonly known, rheumatic fever, and the consequence of which is mitral stenosis, Duckett-Jones criteria by which you diagnose rheumatic fever are also very important, coarctation of aorta, cardiac arrest and CPR is an important essay, aortic regurgitation, clinical signs of aortic regurgitation, jugular venous pulse. And another important essay is hypertension, essential hypertension, secondary hypertension, causes hypertensive emergencies, and hypertension in dental setup. What precautions you should take as a dentist. Atrial fibrillation is one of the questions which have been asked. So when atrial fibrillation is asked, you should also know about the other arrhythmias which they could ask. Respiratory system, the next major topic. You have a lot of questions in the topic pneumonia, lobar pneumonia, pneumococcal pneumonia, all have been essays. Define, classify pneumonia is another essay, and explain about community acquired pneumonia, complications of pneumonia, aspiration pneumonia is a short note. So pneumonia they have often asked. The next major topic, asthma, status asthmaticus, that is acute severe asthma. How do you manage it? Bronchial asthma as an essay separately. Next is COPD, and in which chronic bronchitis have been asked as the short notes. COVID-19 is an essay, which probably they would have asked during the corona time. So anyway, since once it has occurred, we should know about COVID-19. They could ask in any year. Bronchiectasis is an essay. Acute respiratory distress syndrome, ARDS. Pulmonary tuberculosis, TB, is a very common question, irrespective of whether you are writing a microbiology exam, general medicine, or any other subject. Tuberculosis will definitely have a role there, like HIV or AIDS. It will definitely be overlapping in many of your subjects. So regarding tuberculosis, you should know about the anti-tubercular drugs, the revised National TB Control Program. What does it suggest? And hazards of smoking have been asked. Pneumothorax or tension pneumothorax, pleural effusion is an essay, emphysema, lung abscess, respiratory failure have been asked. How do you manage it? Renal system, another short but important topic. As far as dental subjects have been concerned, BDS students often get questions on glomerulonephritis and nephrotic syndrome. AGN and nephrotic syndrome are very common questions. Acute nephritis, that is acute glomerulonephritis, it overlaps. Analgesic nephropathy have been asked once. Gastrointestinal system, another major topic, in which, as you could see, not major essays have been asked, but many short notes have been asked. All these topics overlap. Gastritis, reflux, esophagitis, acid peptic disease, its treatment, peptic ulcer, Helicobacter pylori, one of the major causatives of all the gastric diseases, upper GI bleeding, a consequence of gastritis and severe acid disease, GERD, gastroesophageal reflux disease, dysphagia. What are the diseases in which dysphagia is a common symptom? Chronic diarrhea, ascites, and portal hypertension. So, portal hypertension, how does it happen? The treatment and complications, it is important. So jaundice is another major topic in your gastric system, GIT topic. Jaundice can be separately asked as an essay, or hemolytic jaundice, obstructive jaundice have been asked separately. Viral hepatitis classification and HBV in detail have been asked as an essay. So viral hepatitis, if they ask, you should also know about hepatitis A and other variants. Cirrhosis of liver, how does it happen? What is the management essay? Splenomegaly, hypersplenism have been asked. Causes of hepatomegaly, tender liver have been asked. So the next topic, blood or circulatory system. Anemia is a common topic you have been learning since physiology and pathology, so you know about it. You should just brush up on the management aspect, classification of anemia, hemolytic anemia, and one of the common features, glossitis or stomatitis. Being dentists, a feature of anemia which you will commonly encounter in your practice, you should know that. So megaloblastic anemia, pernicious anemia, iron deficiency anemia, the causes, and it has been asked as an essay also. So, common questions in anemia topic. Leukemia, as far as our exams are considered, CML have been asked often. Other leukemia also, you please prepare, be ready in your for your vivas. Thrombocytopenia, idiopathic thrombocytopenic purpura, ITP, and hemophilia. Classification of coagulation disorders have been asked as an essay. Tetany or hypocalcemia, what is the cause of it? It will also come in your endocrine topic. So Hodgkin's lymphoma, what are, regarding tetany, you should know what are the clinical features seen in tetany. Hodgkin's lymphoma, agranulocytosis, tropical eosinophilia, and shock. Shock is very important in general surgery. Here it has been asked once or twice. So the next topic, nervous system. In our system, epilepsy is a really important topic. Etiology classification of epilepsy is an often asked essay. Grand mal epilepsy, one of the commonly asked essays. Petit mal epilepsy. In fact, when I wrote my exam, epilepsy was the essay question. Seizure disorders is a very common essay. Again, seizure disorders and any one type you have to explain. Status epilepticus, acute epileptic attacks. So, how will you manage it? If you encounter such conditions in your clinic, how will you manage it? And what are the precautions you should take? You should definitely ask the medical history before starting any dental procedure. Bell's palsy, trigeminal neuralgia, and other causes of facial pain. You could also mention about the tooth pain. So, starting from tooth pain, what are the other causes? And explain about these two. Subarachnoid hemorrhage, migraine, and headache. Okay, what are the other commonly occurring headaches? You should know. Stroke, risk factors for stroke. What are the modifiable risk factors of stroke? Parkinson's disease, how you will manage it. Meningitis, TB meningitis, bacterial meningitis, commonly asked questions. Lumbar puncture. So the next topic is infection and communicable diseases. So just let us run through it quickly because no common essays have been asked here except for TB and HIV. But here many short notes have been asked. Mumps, complication of mumps, measles, rubella, and congenital rubella have been emphasized. Primary complex, miliary tuberculosis, oral manifestations of herpes simplex, one of the commonly occurring disease in your oral cavity for children, oral manifestation of HIV, being dentist, concentrate on oral manifestations. Herpes zoster, what it is, chicken pox, so both are related, be sure of what is what. HIV transmission, AIDS, universal precaution and post-exposure prophylaxis of HIV infection, diagnosis of AIDS, investigations of HIV, enteric fever. So these are the HIV questions. Coming on to the enteric fever topic, typhoid, Vidal's test, they overlap. Cholera management have been asked once. Dengue fever, dengue shock syndrome has been asked as an essay. Treatment of malaria complications have been asked as an essay once. Mucormycosis, candidiasis, two fungal infection, tetanus and diphtheria, two bacterial infection, gonorrhea, one sexually transmitted disease, clinical features of which have been asked, hepatitis B, mode of transmission prophylaxis. We already saw hepatitis B in jaundice, right? Viral hepatitis. So here also they have asked mode of transmission prophylaxis, amoebic dysentery, amoebiasis. So the next topic, malnutrition and deficiencies. Kwashiorkor, marasmus, you should know, you have been learning it from the school times. Protein energy malnutrition, malabsorption syndrome, the only essay from this chapter, and all the other common questions. Vitamin D deficiency, rickets have been asked. Vitamin C deficiency, scurvy have been asked. A deficiency and vitamin B deficiency, beriberi, pellagra. So you should know all these things. Balanced diet, what it is. The next chapter system is endocrine system, in which you have the main gland, that is the thyroid gland. Thyrotoxicosis, hypothyroidism have been often asked as an essay. Hypothyroidism in children, which is cretinism, myxedema coma, and acromegaly, which is about pituitary gland. Gigantism have also been asked. Classification of diabetes mellitus, it is another important disease belonging to the endocrine system. Type 2 have been often asked. See again, diabetes mellitus is another huge topic. Complications of diabetes mellitus, oral hypoglycemic agents, hypocalcemia, the clinical features we already saw in blood chapter, right? Tetany, the clinical features of tetany have been asked as an essay. Steroid abuse, ketoacidosis, diabetic ketoacidosis, Graves' disease, we saw in thyroid, Addison's disease, Cushing's syndrome, hypoglycemia, and non-insulin dependent diabetes mellitus, which is also known as type 2 diabetes mellitus. So all these questions have been asked in the endocrine system. Next, you have the final chapter, which is general or miscellaneous topics. It will overlap in all of the like subjects also. Like most of the dental questions have been asked, like Ludwig's angina. So I have clubbed them together in general topic. And certain drugs have been asked in detail, which you have learnt in pharmacology. So the red color one, which I have blocked here in pink, are the drugs which you have to refer back in your pharmacology book to write more points. Only your general medicine points will not be enough. So let us see. Cyanosis and central cyanosis are clinical features to learn about. Clubbing we saw earlier. So beta blockers, bronchodilators, calcium channel blockers are the drugs asked here. Gingival hyperplasia. What are the drugs which causes gingival hyperplasia? You can also refer your perio book. Anaphylaxis have been asked. Anaphylactic shock also you should know. Causes of hemoptysis, one of the important clinical features. Color changes in oral mucosa and tongue, and the relation of which to systemic disease. So you should know about that, similar to oral manifestations, right? Non-pharmacological management of non-communicable disease, one vague topic, you should know about it. Fraser syndrome, narcotic analgesics, one of the drugs. You should refer your pharmacology book again. Ludwig's angina, refer your oral surgery or oral pathology book for this. Antihypertensive drugs, anticoagulants, causes of hemoptysis, antitubercular drugs, the treatment and the adverse effects of drugs. Metronidazole. Allergic reaction, classify allergic reactions, features and management of generalized anaphylaxis, again as an essay. Anaphylactic shock, Vincent's angina, ANUG, bronchodilators, anti-epileptics, human insulin, newer insulins, refer your pharmacology book. Fluorosis of teeth, aphthous ulcer, ACE inhibitors and ARB, angiotensin receptor blockers, refer your pharmacological book. Local anesthesia and its reaction, echocardiography, one of the diagnostic modes, oral manifestation of systemic disease, sulfonylurea, metformin, syncope, medical emergencies in dental practice, another important topic for your viva aspect also, hypertension and the dental consideration. So we have almost seen many vague topics here. bilateral pedal edema, one clinical feature, beta blockers, COX2 inhibitors, furosemide, general examination of a medical case, practical question, adverse drug reaction, collapsing pulse, what it is, bleeding from gums, etiology and management, refer your career book, hematuria, oral manifestations of hematological disorders. So these are the major questions that have been asked in the past 15 to 20 years. This has been referred from the Tamil Nadu government syllabus, like MGR University syllabus. So mostly since the DCI syllabus is the same, it overlaps with other universities also. Anyway, all the best for your exams. These questions will almost cover your syllabus. Do well.